Hello, my name is Gabrielle Spatz, and today I will be presenting on a communication challenge, this challenge being replacing the pager system in the hospital with a messaging system. So to give some background, I work in the emergency department at Lancaster General Hospital. Currently, we have had the need to hold patients in the emergency department due to COVID and some other circumstances. And the patients that we are holding include our observation patients, as well as our med-surg admissions, and even now some critical care admissions as well. The only way that we have to communicate to the admitting physicians of these patients is through paging the on-call doctor who is in-house, and often sometimes that doctor is not even the doctor that admitted the patient. So this problem, the main way of communication between advanced practitioners, physicians, nurses, and other hospital staff is through the paging system. The nurse or other hospital staff would page either the APP or the physician about an issue and then would await a response. And this causes some longer wait times for answers to pages depending on what the physician or the APP is doing. Can cause frustration from the patients that is verbalized to the nurses about having to wait for a pain medication or orders to eat or other different things. And lastly, poor open communication between staff. So it's quite frustrating as an emergency nurse being used to going up to the physician and saying, "Hey, Dr. Martin, I need an order for pain meds. Do you mind putting it in?" versus having to page a doctor, not knowing if they got the page, waiting for the order to be placed, or waiting for the doctor to call back and ask why this intervention is needed. So it does kind of present that there's poor communication between staff through that elongated process. So the use of the pager. I did some research on the use of the pager, and in the article Slow Death of the Bleep, it states that pagers are a slightly obsolete technology and that the world has moved on. And I do believe that this is pretty accurate, that most of us have a cell phone now. Most of us, have the Apple Watch or, smartwatch on our wrist. And, we're very much a technology using society. Also through this research, I found that pagers are mainly popular with doctors because they are small, lightweight, and have a long battery life. They are reliable, and typically don't have network connectivity issues. In general, the way they work, the way that they are intended, and their functionality is pretty standard. This is pretty true, but also the functionality of our phones is pretty standard as well at this point, and I do believe that pagers are of the past and it's time to move forward. Additional research that I have found is that over the last decade, two-way text messaging on mobile devices has quickly replaced almost all one-way paging systems except in medicine. This is quite shocking since medicine is normally very forethought and very advanced and constantly moving forward, but this is just an area that hasn't seemed to do that yet. And a large reason I found in the research that has not is there's false feelings that there is minimal security with text messaging. But through this research, I found that there is a deep amount of security with electronic use, and that includes sign-on with a required password, which typically has to be more complex, encryption, delivery, and read receipts, customize message retention, remote deactivation if the device is lost or stolen, and a lack of message preview that can be turned on or off. The message preview part is really important since in the hospital it's very important to not break HIPAA. That would be a sure way to ensure that that would not occur. Additional research shows that lack of closed-loop communication, and often the sender does not know if the message was received, and this is something that I have experienced pretty frequently is, you send the page and it's been a little while and you don't hear anything, so then you sit on this, well, do I respond, or sorry, do I repage the physician or do I wait for a response? And the last piece of research I found that supports making this change is that data published by the Joint Commission in the United States has consistently highlighted errors in communication as the most common root cause of sentinel events, with handoff errors being implicated in as many as 80% of all adverse events. So the stakeholders that would be in this implementation and change of communication are physicians, nurse practitioners, and physician's assistants, nurses, patient care assistants, respiratory therapists, managers, house supervisors, patients, leadership, and etc. Replacing pager solution. So currently at our hospital at Lancaster General, we have what is called a mobile heartbeat phone. This is a phone. It's very similar to an iPhone, and it has the technology on it to talk to basically everyone. So everyone is provided a number. My personal number is 1203293, which is basically like your extension, and you can give that to anyone, and automatically your calls will be directed to you. And many physicians' numbers, etc., are implemented in there. It's just that the messaging portion of that is not used. But by reducing the use of pagers and implementing the use of the messaging system, it would provide for quicker responses, improved patient care, and easy use, and not a huge amount of change for staff. Challenges to implementation would be resistance to the change due to seasoned folks in the field not liking it, a lack of support by leadership and stakeholders, technology crashing issues, age consideration and HIPAA, and a cultural consideration would be language barriers for some of our staff that are English second language speakers. And lastly, the way that this would be evaluated is through patient satisfaction surveys that include an area specifically about communication with staff and the patient. A survey sent out to staff about how implementation is going, what measures can be taken to fix or improve issues that is noted to be happening, and lastly, tracking the amount of time it takes for responses compared to the use of a pager. These are the references that I used in my presentation as well as for my research today. And lastly, implementing this messaging system would make a huge difference in communication as well as truly benefit patients. Thank you.